Hi, I'm Phil Zeke, and I agree to participate in this educational video. Or I consent, excuse me.
Okay, so we are going to check for cervical motion and going to perform an articulatory technique. So I'm going to start by using TART criteria. So I'm just doing a general observation. It appears that muscle masses on either side are equal, and I don't see any obvious head tilting or asymmetry. Is it alright if I palpate?
Yes.
Okay. So I'm just going to palpate for tissue texture changes, tightness, ropiness, anything like that. It feels pretty even. Is anything tender?
Nope.
Okay, no tenderness. I'm going to check for some just overall range of motion. So I'm going to have you bring your chin to your chest for flexion. Okay, and then look up toward the ceiling. Good, and then bring your right ear to your right shoulder. Left ear to your left shoulder. One more time to the right. Okay, and then I'm going to have you look over your right shoulder and over your left shoulder. Okay, so overall range of motion is pretty good and pretty symmetric. So I'm also going to do an active range of motion. So go ahead and lay down for me. Okay, again, just palpating. The right side may be a little tighter here. Okay, so checking for side bending. I'm side bending by translating him to the left and then translating to the right. And it's more restricted in general in translation to the left, so in side bending to the right. And for rotation, I'm going to lock it out to 45 degrees. Check rotation. Rotation's pretty equal. Checking for extension. And then for flexion. So I think the biggest restriction that you have, Phil, is in right side bending, so I think we'll focus on that if that's okay with you.
Mm-hmm.
The osteopathic models can be applied here because the structure and function of Phil's neck is restricted, and because that's restricted, it may be impinging on the neurologic function. It could be blocking lymphatic flow, vascular flow. By releasing this restriction, we would be able to get all of those things working better individually, and they're together, therefore working better as a whole. So maybe Phil had trouble sleeping. Neurologically, that's an issue because of this structural function that may seem unrelated. All of these models can be applied here and improved with this treatment.
Okay, so first we're just going to approach the barrier, and then we are going to spring on that restricted barrier until we feel a release or a tissue texture changes that would be a sign of relaxation. So I'm just going to use the pads of my fingers on these articulatory processes and spring the cervical spine into right side bending, going to the barrier each time. Is that okay, Phil?
Yep.
Okay, and then I'm going to recheck, so that right side feels like it has more give now. And then translating it to the left, it does feel like it has more motion, similar to left side bending now.